confession plea onto YouTube in recent days. So, Dr. Bajwa, thank you for joining us today.
It's my pleasure, Michael.
So, as I said, you posted this video onto YouTube. Why did you decide to record this video? Was this about dealing with your anxiety, or was it a feeling of frustration about what you're seeing out on the streets?
There was just one reason behind it, and the main reason was that I needed to get that message out that before we have any medicine for this, before there's any vaccine, we need to do something now. And that message right now is we need to isolate ourselves to prevent the spread of this virus. And that's the biggest weapon that we have right now. We need to deploy that weapon. We need to isolate ourselves in order to stop the spread of this. Because if we don't, then our healthcare services will be burdened. And I didn't want to see that happen. I wanted to get that message out there to people so that they would help us flatten this curve, help us help you.
Okay, well, you know, that's a message that we've been hearing from public health officials all the way up to the Prime Minister. Why did you feel the need to reiterate it yourself?
I was seeing out there that a lot of people were not heeding the message. I was seeing that people were still playing basketball, they're still having parties, they're still having these social get-togethers. And that's the reason why I wanted to reiterate the importance of this message, because people were not quite getting it at that time, and that's the thing that we have in our power to make this thing go away. And that's the reason why I wanted to put an honest message out there to give people the truth about this virus, and so that we could head in the way that South Korea and Taiwan and the good countries ended up dealing with this, and not go the route of Italy and Spain and others, where they were unable to grasp this early, and they ended up with a lot of casualties.
A lot of casualties, hundreds of people dying each night when it comes to Italy's case. And interestingly, perhaps even worryingly, in your video, you say that people in this country just have no idea how widespread this infection is, that the numbers being shared by the media don't really capture how many people have either the virus that leads to COVID-19 or COVID-19 itself. Explain that. What do you mean by that incomplete picture that Canadians have?
The only way you can confirm a case is by testing them. And early on, we were not doing the testing. Only a few days ago did the Prime Minister announce that we would be doing 10,000 tests per day. But prior to that, it was far fewer cases that we were testing. And so the number that they say that these are X number of positive cases that we have in Canada, that doesn't fully represent the picture. The picture is probably many times worse than that, because there are a lot of people out there who have it, and we will never know if they have had it because they were never tested in the first place. Unlike other countries, for example, South Korea, where they did testing by the tens of thousands per day, and that's the way they were able to capture the correct number and isolate those people and nip this pandemic in the bud.
So do you think we should be expanding testing at this point more than what we're already seeing right now?
So the current rate that we're doing, about 10,000 per day, is much more acceptable than the rate that we had initially. And for whatever reason, whether we didn't have enough supplies or reagents or enough testing facilities, for whatever reason, the initial response to it was inadequate. And now we are getting to a stage where we are far better off with the 10,000 per day that we're doing.
Now, you're on the front lines, you're an ER doctor. Talk to us about what you're seeing and how hard-pressed is the system right now to deal with the number of COVID-19 cases that are appearing?
So initially, we did quite a bit of good preparation for it. We tried to get enough ICU beds available. The ORs were emptied. The elective surgeries were canceled. The ER departments made enough room and capacity so that we would be able to deal with the surge. And a week or 10 days ago, we were finding there was an eerie calm at that time, because the people who were coming in with COVID, they were walking in, they were relatively healthy. Only in the past week or so are we now starting to see the sicker patients come in, the people who are requiring intravenous support, oxygen support, and also the people who are getting to the stage of ICU. We're really starting to see that wave come in the past week or so.
So how much longer can this go on, do you think?
I think the overall messages to Canadians that we're in this for several months. I don't think the peak has hit yet, and I don't think the peak is probably there for another several weeks. in fact. And only after that will we start to see a decline in the number of cases. But this is something that we're stuck with for the next several months, likely.
Which is why you want people to take action right now.
I still want people to please heed this message of social isolation as our biggest defense right now. Let's use what we have in our power to stop this virus so that we don't have that surge. We don't have a lot of damage in terms of the number of casualties, the number of people dying from this. I really hope that people start taking this message to heart, and then we can control this.
Dr. Bajwa, thank you for this. Appreciate the time.